So let me tell you a little bit about alkaptonuria. It's called black bone disease because the cartilage and connective tissue and bones turn black because of the accumulation of a particular substance called homogentic acid. But it's really rare, so it's considered to occur in probably about 1.25 million births in the United States. And that means that there'll be about 1,000 individuals in the United States with this disorder. And the defect in this disorder is that the patients are unable to break down a chemical called homogentic acid, or HGA. And the body produces homogentic acid from tyrosine, which is one of the 20 important amino acids that makes up our protein, that makes up the protein of our body. And the protein is turning over constantly. So that means that there's a constant production of tyrosine itself, and then the breakdown products of tyrosine, including homogentic acid. And when this starts to accumulate, its breakdown products bind to connective tissues. That's ligaments, tendons, cartilage, bone, etc. Turns them black and destroys them. So this is not diagnosed in newborns at the current time, but you'll see in a minute that it can be diagnosed sometimes in infants. The patients are generally diagnosed in adulthood when the tissue damage causes them to have problems with their joints and connective tissue. But it can be diagnosed in infants because that homogentic acid that accumulates and its breakdown products produces a brown or a black color, which is in the urine, and therefore it stains the diapers of infants.
Indications. Harlequin nitisinone tablets is indicated for the reduction of urine homogentic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not take Harlequin if you are allergic to nitisinone or any of the other ingredients. Inform your healthcare provider of any health problems and if you are or are planning to be pregnant and/or breastfeeding. Serious adverse reactions. Eye symptoms and skin changes. Inadequate restriction of tyrosine and phenylalanine intake can result in elevated levels of plasma tyrosine, which may lead to eye problems and symptoms including keratitis and painful hyperkeratotic plaques on the soles and palms. Your healthcare provider will obtain a slit lamp examination prior to initiating Harlequin treatment, regularly during treatment, and may also re-examine you if you develop symptoms or if your tyrosine levels are above 500 micromole per liter. Harlequin may be temporarily interrupted until symptoms have resolved. Changes in blood profile. You may develop leukopenia, reduction of white blood cells, and severe thrombocytopenia, low levels of platelets. Your healthcare provider will monitor platelet and white blood cell counts during Harlequin therapy. Common adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in the clinical trials are elevated tyrosine levels, thrombocytopenia, low platelets, and keratitis, inflammation of the cornea, eye irritation, eye pain, photophobia. Drug interactions. Nitisinone can interfere with the effect of other medicines. Tell your healthcare provider or pharmacist if you are taking, have recently taken, or might take any other medicines. Use in specific populations. Pregnancy. The safety of this medicine has not been studied in pregnancy. Tell your healthcare provider immediately if you become pregnant or are planning to become pregnant. Lactation. The safety of this medicine has not been studied in breastfeeding women. Tell your healthcare provider immediately if you plan to breastfeed. Pediatric use. The safety of this medicine have not been studied in pediatric patients with AKU. Geriatric use. Clinical studies of Harlequin did not include a sufficient number of patients 65 years of age and older. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. Report any side effects, including any not listed above, to your healthcare provider. For more detailed information, please refer to the full prescribing information at harlequin.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.